will double back to you in a few moments. I do want to take the time now to introduce three additional panelists that have been patiently waiting. And the point of bringing them on board is to demonstrate the types of talent that exist in services delivery that hasn't, quite frankly, gotten the type of opportunity that a culturally sensitive and specific initiative like the Simcoe solution will offer. So allow me, just pay attention to the type of talent that exists that we're going to be trying to bring on board. And we're keeping in mind that we have a total of over 100 vendors with whom we'll be working. Angela Ratcliffe, welcome. Angela is the president and CEO of CAM Alliance, having founded it in 2006. She's been active in the fields of healthcare, education, and mental health services, focusing primarily on mental health, addictions, and housing for the homeless. CAM Alliance has been awarded with 3 multi-year contracts with the Illinois Department of Children and Family Services. CAM Alliance has also been a licensed Illinois Department of Substance Use Disorders provider. CAM Alliance has been awarded the City Best Spectrum Award for Excellence in Customer Service for 6 consecutive years. And CAM Alliance has successfully provided employment and internship opportunities for over 400 individuals in its 15-year history in the state of Illinois. Welcome, Angela. Brian Robinson actually founded Innovative Regulatory Risk Advisors, LLC. Brian is an attorney and a senior managing consultant and subject matter expert with over 17 years of demonstrated subject matter expertise in legal, risk assessment, business advisory, and regulatory compliance. He's been a key subject matter expert providing value-added services to leading Wall Street banks, financial institutions, including and not limited to investment banks, hedge funds, international trade finance, correspondent banks, cryptocurrencies, and offshore jurisdiction clients. He's been busy. He holds additional industry regulatory expertise that includes healthcare, emergency management, disaster claims, pharmaceuticals, environmental, construction, and governmental agencies, and obviously many others. And if he'll tell you what he'll be doing in a moment, so I won't steal his thunder. And last but certainly not least, I'd like to introduce you to Sheena Michelle. Sheena Michelle is actually owner and president of Loving the New Me Fitness, having been founded in 2010. She's actually known as the Super Trainer, and she's provided services to clients, including a lot of celebrities that you know in Texas, Georgia, California, Florida, and Illinois. And her mix of nutrition, health education, and personal training has established a very loyal and successful clientele. From a background that includes being a medical assistant and a medical executive assistant, Loving the New Me Fitness is now prepared to join in a broader scope of care, including community-based services. So thanks to all 3 of you. Are you here? Let's flip over. Welcome, Brian. I see you.
Yes.
Hi there.
Hi, Sheena, Michelle, and do we have Angela? Well, let me go ahead and start. I have 3 questions that I want to ask each of you. I'm just basically going to ask you to tell us about your vision for working inside the Simcoe solution, how you bring your talent to bear to further our goal of improving healthcare and healthcare outcomes in the state of Illinois. So Brian, let's start with you.
Sure. Thank you for having me, and thank you to the Illinois State Black Chamber and the state representatives. Innovative Regulatory Risk Advisors provides critical healthcare, regulatory compliance, and risk management advisory services at the highest levels in public and private healthcare to ensure continuous compliance with the laundry list of state and federal healthcare regulations. Our vision encompasses supporting the strategy, development, and implementation of Simcoe's compliance, regulatory affairs, risk management programs in conjunction with promoting a foundation of transparency, flexibility, and innovation.
So Senator, all of that is to say that Simcoe has been working with Brian's firm for quite a long time now, ensuring that regulatory compliance and things that you would be concerned with on the back end have already been part of our conversation by someone who has a long track history of demonstrated expertise. Sheena Michelle, can you answer that same question? Tell us about your vision for working within the Simcoe solution.
Hi there. Can you hear me?
Yes, we can.
Okay. The Simcoe solution for me will provide me with a very massive canvas to enact my vision for wellness through personal training to the citizens of the state of Illinois. And excuse me, I apologize. I'm reading because I didn't memorize everything, but I wanted to get it right. So with my company, Loving the New Me Fitness can provide dozens of hours of personal training services at each of the health hubs across the state. And there's also virtual training. So for people that don't like to train in big crowds, if you want to just train personally on your own, or if you can't even get there, this is an opportunity for you to come in and still get fit. But preventative health, fitness, definitely lies in there.
Thank you. Do we have Angela on the call yet? If not, we'll double back to her. And let's stay with you for a second, Sheena Michelle. Now, being able to do
Okay.
this was kind of a self-evident truth, but being able to do this on a statewide level for a big old contract like we're proposing, how would that impact your business?
Greatly. It would greatly impact my business. It would be mind-blowing. Just the thought of even being here with such great people it's so humbling. And but just to be able to help so many people change their lives and provide preventative health care through fitness and nutrition, I feel like it's a bigger opportunity for me to contribute the health of this to so many people in so many different places. So I feel like I've been doing this for over a decade, but if given this platform, I feel like I will definitely reach the level of people that I have been trying to reach and help a lot of people reach the goals that they're trying to reach, which is staying out of the ER and loving the new them. Thank
you. Same question to you, Brian.
So we've done work previously with the Illinois Department of Health, and we are a approved vendor for Centers for Medicare and Medicaid Services. So supporting the Simcoe solution will allow us to continue to grow our footprint, create more job opportunities, and be a part of a transformational organization that will undoubtedly disrupt the U.S. healthcare industry and enhance the health and safety of historically underserved communities in Illinois and beyond.
And I apologize in advance for the next question, but somebody may be thinking this, so let me go ahead and ask you, are you ready?
Yes, we stay ready.
That's exactly right. See, you're using the right verbiage there. We stay ready so we don't have to get ready. How about you, Sheena Michelle? Well, you're on mute, but I hear you shaking your head, so I'm trusting that you're saying yes. I'm sorry, I said yes. I did the motion. Yes, you stay ready so that you don't have to get ready. That's right. So the other thing, thank you both. And, I do want to take a second and tell you a little bit about CAM Alliance since they aren't here. I did make the introduction, but the way in which they plug and play into the proposed Simcoe solution, and I know we haven't gone into it in great detail, but their services really focuses on mental health, wellness, and prevention. And they are prepared to offer mental telehealth services, imagine if you will, to communities in total across the entire state. So that's something that we think is a particularly sensitive area needing to be addressed. It represents health inequity and health disparity. And we're very pleased that we are helping them grow their capacity by pulling on national resources to grow their capabilities, such that can be provided across the state. So I want to thank you all and just stay tuned, because now what we're going to do is we're going to open up for some questions. So I will specifically ask people to, there have been a ton of comments, but I didn't see very many questions. So I'm looking for questions, and I'll read one from Ryan Angelotti. I apologize if I got that name wrong, but question for anyone on the panel: is the Simcoe Solution website vendor opportunities section the best place to register for interested vendors looking for work opportunities? Absolutely, yes. We want this to grow in many different directions. Even as we begin the conversation talking about how to deliver health prevention and health promotion across the state, we want to establish a foothold as a voice and a trusted vendor in the state of Illinois for all different types of healthcare opportunities. So all of you that own businesses or want to conduct business in the healthcare space, we will create capacity by your presence. So please, everyone, please go to thesimcoesolution.com, click on vendor opportunities, give us a copy of your capability statement and information about your principles, and we will have a one-on-one conversation with you about what you do and how that could potentially fit into the solution that we're trying to bring forward to the state. I am welcoming additional questions from the audience? Let me see. Thank you, Ryan. While we are continuing looking for questions, I will ask any of the panelists if you have been prompted to offer any additional comments. So if any of you want to jump in at this point while we're looking and waiting for additional questions, please go ahead and do so.
Dr. Sterling, this is Dave Kaler. If I could just follow up on something that Dr. Lubin Johnson had mentioned about the healthcare pillar. And I hope all of you are aware that we passed last year the 4 pillars of justice, which came out of the Black Caucus in both the House and the Senate and were signed into law. And I will tell you, Dr. Lubin Johnson, that I sit right next to Senator Maddie Hunter. It's my seatmate on the floor of the Senate, good friend, very dedicated senator in terms of healthcare issues and a lot of issues. But Maddie's a good friend, and we have talked about this. The commission is not up and running yet, is my understanding, but it will be. And you know, I think that there's a realization amongst many of us in the legislature that we have to do things in a much better way than we've done before in terms of healthcare. That's why I said in my opening comments that we've done a lot of big things since J.B. Pritzker became governor, and it's all been good and well. We now have to really take on the issue of healthcare in a very profound way. And I know with colleagues like Senator Maddie Hunter and others, we will do that.
Thank you for that.
I'd like to respond. Thanks, Senator Kaler, again, for your kind remarks in relationship to me. And Senator Hunter, I've actually known her since before she was a senator. She was actually vice president at HRDI, an organization that provides mental health substance abuse services, where my mom was chair of on the board for 14 years. I just want to say that I hope that with both commissions that we will find out when the appointments will be taking place for those. I think that people from the organization I'm part of, Cook County Physicians Association and Prairie State Medical Society, should be members of that commission. And there was another one established in this pillar also. But also, we want to see some true action in terms of dollars going to businesses in the state that it talks about. I was at a meeting last night where Rashard Johnson, the president of Trinity, was speaking, who has a seat on the Southside Collaborative Board, and they're still meeting twice a week with HFS, but they haven't got any dollars yet. And this stuff was signed into legislation 4 months ago. And so I know Rome isn't built in a day, but I'm hoping it's not going to take 20 years either. So thank you.
So and I agree with that. Yeah, this is too big an issue to let it wait much longer. And I think that my intention, and I'll work with others like Senator Hunter, who is really a champion, and she was the sponsor of the healthcare pillar in the Senate. We need to ask some very tough questions and get this thing turned around. So you've got my commitment on that, and I know there are many others that feel the same way.